Next up is Dr. Cathy Phillippi. She's going to be our next speaker. She joined the beautiful brand new Trustcare Kids actually just this year in January. But prior to joining Trustcare Kids, Dr. Phillippi practiced at the Children's Medical Group in Jackson and also in Birmingham. She earned a Bachelor's of Science degree in biology from the Mississippi College in 1994 and her medical degree from the University of Mississippi Medical Center in 1999. She completed her pediatric training at the University of Arkansas for medical sciences. She is an avid Auburn fan, which we won't hold that against her, and she is married to Dr. Mark Phillippi, who is I'm sorry, I just lost
nephrologist.
I'm sorry, I just lost my place. Nephrologist at the Central Medical Center, and they have 3 beautiful children. And so thank you, and very, very welcome to have you. We're so excited to have you here and for you to share about Trustcare Kids too. So thank you so much.
Sure. Well, thank you so much. I'm excited to be part of this. I love things like this. I love my job, and the opportunity to be at Trustcare Kids has been really fun because not often at 49 years old do you get to redefine your career. I know Dr. Glick talked a little bit about that, and that is exactly what happened for me. I'm so grateful for this opportunity and would love to see you if you have an urgent care need or if you have the need for a relationship, which is what I'm going to talk about. Being a pediatric resident, the last year of pediatric residency, when I had my first child, I felt like I knew everything about having children. I had rotated through OBGYN. I had watched lots of different deliveries. I had been a resident for 3 years. And so I felt like I knew everything about breastfeeding, everything about babies, had studied, had access to all the information you could possibly need. And I took home I had a delivery that ended up being very traumatic. It was not what I planned. And I took home a baby that would not breastfeed well. We moved to a different state 10 days later, and I got mastitis in the car on the way from Arkansas to Birmingham. And I had nobody. I had no family, no friends. My husband went directly to fellowship, and it was the first time I had not worked in a very long time. And I suffered from pretty significant postpartum depression. So even with all the information in the world and the best attitude ever, all I ever wanted to do was get married and be a mom. And I ended up being a pediatrician too, which I thought was such a bonus. But what ended up happening to me happens to a lot of women who are on the right track and have a mindset just like I did, that this is going to be awesome. And it was not awesome for me. I don't even remember a lot of that time. And so when patients come in for the 2-week checkup, which when you have your baby here in the Jackson area, and I think in most hospitals in our state, the neonatologists will check on your baby in the hospital, and then you'll follow up with them for a weight check after discharge home. And your first appointment with a pediatrician will be at 2 weeks of age. I always tell patients that ask me, when should I make the appointment? We're going to work you in. So you call as soon as you can after you have the baby, or you have your husband or your mom or somebody call and make the appointment for the 2-week checkup. At the 2-week checkup, no shots are given. That checkup is an opportunity for the pediatrician to get to know you, to get to know your situation, to check the baby to make sure there are no new findings like jaundice or poor weight gain or spit up or bowel movement problems or sleep issues or developmental issues, heart murmurs. So we're going to do a really good physical, but I'm going to spend most of my time talking about the part of the checkup that I think is more important than the physical exam, which is the social exam. And for me, the social exam is not socializing. It is figuring out who this baby lives with and mentally, are they okay? They might live with a mom who recently found out she was pregnant and ended up having a baby, and the dad is not involved, so she lives with her parents. And it might be a couple like my husband and I, 2 physicians who are supposed to know how to raise a baby. And guess what? We had no clue, and we were really dying. So our pediatrician was key for us. And honestly, at that visit, I'm asking how breastfeeding is going, because my breastfeeding was not good. I wish I had a Dr. Glick. And when I was in between jobs, I would walk a lot because all 3 of my children, I have 3 children. I have a freshman at Auburn. I didn't become an Auburn fan until I married my husband. So I was a Mississippi College fan, but that, whatever that is. And then my daughter is there now. So I have an 18-year-old who is a freshman at Auburn. I have a junior in high school that's a girl, and then I have a 7th grade boy. So my first child was the most difficult in the sense that we moved 10 days after she was born. We moved to a state in a city where I didn't know anybody, and I didn't know my caregivers. And when I went to the doctor, nobody knew that I was a doctor. I had to say, hey, I'm a pediatrician. I'm just, I just moved here. So I will say, for all of you, use that time. Your pediatrician may or may not pick up on the fact that you're not right or not okay. Utilize them. They're a wealth of knowledge, and they want to know. We're human beings, and we want to know you. Sometimes I misread a patient, and so it's really important for you to speak for yourself and advocate for yourself. At the time that I was suffering from postpartum depression, I really could not advocate for myself. My husband had to. So for those of you who have spouses, tell your spouse, if I'm acting crazy, if I'm crying all day, please, talk to our pediatrician about it, or our OBGYN, because Dr. Hood, I'm sure he won't see you back until probably 6 weeks for the 6-week checkup. And so a lot can happen then, and a pediatrician is the one that's going to be seeing you. So at that first visit, I'm making a social assessment of the baby. I'm looking at your plans, like, do you plan to stay home with the baby? Do you plan to get a nanny? Do you plan to go to daycare? And then I'm going to answer any questions you have about the baby. And I will tell you that even though I studied forever to learn to be a pediatrician, I had questions. I had questions about acne on their face and their skin peeling off. No one taught me what that really was, or why you couldn't use lotion or shouldn't. And so there are lots and lots of factoids that we've grown accustomed to being asked. So ask anything, ask everything. And every baby is different, so you can't apply every rule across the board. Unfortunately, my breastfeeding did not go well. I did not have a lot of help, and at that time, there weren't a lot of lactation consultants around, and I ended up having to give the poisonous formula. And I felt like the biggest failure. I was already struggling with postpartum depression. I was not sleeping, and it was really hard for me. I will say that, in a perfect world, in a perfect scenario, I would go back and redo that, because I did not bond well with my child for those 2 reasons. We are really close now. So you get a million cajillion do-overs every day. You are going to stink it up as a parent sometimes, and it's okay. And so that should reassure you that if you are worried about whether they have slept 3 hours or 2 hours, and you can't remember when you started the feed because you're trying to time when to wake them up again, it is going to be okay. I promise you. Babies are super resilient. It's one reason I love pediatrics. They get well, they bounce back. I have had I have had pediatric patients go through terrible, devastating illnesses or the loss of a limb or a cancer. And you know who does better? The patient. The parents have a terrible time with it. So I will tell you that your baby is going to be okay. So your biggest asset in those first few months of life is your pediatrician. So I want to be an example of that by telling you that I have a patient who came to me. I met her at the 2-week visit, and she is involved in this webinar. And she brought her baby to me, and as we're talking, we're standing on either side of the bed. The baby's laying on the bed, and I'm saying, how are you feeling? You know, how's it going? How's your delivery? And all of a sudden she said, I don't feel so well. And she proceeds to pass out. Well, I, got the baby, called my nurse, we assess her, and she is not breathing well. So we get the oxygen, we call 911. She kept her pulse and she breathed throughout the event, but it turns out after the ambulance came and took her to the emergency room that she had a pulmonary embolus, which is a clot, and it went to her lungs, and it could have killed her. So to this day, every time I see her, I remember that moment, and it bonded us forever. And even if she moved away for 5 years and came back, that I would remember that instant that we became friends over this crisis. And she had to get a family member to come get the baby. I mean, it was an event. So those types of things are things that you're going to walk with your pediatrician through, and it will help them better take care of your child. So you will come at the 2-week checkup, the 6-week checkup, which is called the 2-month checkup, but really we would prefer you come at 6 weeks. The reason for that is it's the first set of shots. We talked a little with Dr. Hood about the pertussis vaccine. That vaccine is super important for anyone who's going to be around the baby. The only death that I have seen in my practice that was preventative was a pertussis death. And it was actually not my patient, it was a patient of our practice. And what happened was the baby was planning to go to an in-home daycare, and the person keeping the children was being helpful by saying, you can come on Monday since you're going for your shots on Wednesday, and just bring me the shot record. Well, someone in the daycare, it was a very small daycare, home daycare, had a cough. And in a grown-up, pertussis can just be a nagging cough. And the baby got pertussis and ended up, after a long hospital stay and ICU stay, passing away. So that is a real scary scenario. It is really important to get all of the adults in that infant's life immunized. Grandparents are often behind on their tetanus pertussis booster. And my husband would say he has seen 2 cases of tetanus in a 70-year-old grandmother who loves to garden and is behind on her tetanus shot. And tetanus is a grueling, terrible death. So you need to have a booster of that. If you don't know if you've had it, it's better to get another one because you want to be immune to pertussis before you handle the baby. So you'll come at that 2-week mark, the 6-week mark, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, 2 years, and then yearly after that. So you can only imagine all of those appointments and the appointments you would come for, sick visits. You're going to really get to know your pediatrician, and you and he or she are going to have a unique relationship. I have walked people through very unusual stories, very tragic stories, cancer diagnoses, and a lot of my patients are aging out of pediatrics. The great thing about Trustcare Kids is I had an opportunity to redefine my practice. I have lots of kids that have been with me for a long time and are now in college. And because the diseases that affect college students are now diseases that affect 16-year-olds. So STDs, unwanted pregnancy, depression, anxiety, ADHD, asthma, diabetes, obesity. All of those things are things that can start earlier than it used to 20 years ago. And so those patients can stay with me now. Trustcare Kids will see through college. So if you need a medical home for your child that's home from college, who needs a checkup, or who needs their asthma medicine checked, or who needs immunizations, please check us out at Trustcare Kids in Gluckstadt. So the importance of the checkup. The checkup is important because 2 plots in time are better than 1. Same thing about development. Every time you come, I'm gonna check socially, meaning where does the child live, who does he live with, he or she live with, and how is everybody? Are they okay? If the child is 5 or 7, I'm gonna ask questions about, do they make friends easy? Socially, it's going to change. And if they're teenagers, I'm going to ask them what they post and whether their posts are something they would want me to read. I will talk to them about inappropriate use of their phone. I will talk to them about inappropriate attire and posting of that. I will talk about sex with my adolescents. I will talk about drugs, vaping, alcohol use, risky behaviors. I'll talk about anything you need that is age appropriate socially. And then second is safety. So a 2-week-old, there are safety issues. We need to make sure that all of our smoke alarms have a battery that works and that the smoke alarm works. We need to make sure our babies are not bundled up and in a cushy environment and that they're sleeping on their back. And that can be complicated. So I love to talk about that because it's a free-for-all. It is a complete free-for-all when you bring a baby home from the hospital. So we talk about safety, and that will evolve over time to safe choices, like I just mentioned, in an adolescent. I'm going to talk about diet. So that would go from breastfeeding or bottle feeding or whatever you choose to healthy choices in teens. I will talk about pooping. I talk about pooping more than any other doctor except a GI doctor. So I talk about pooping all the time. I love to talk about pooping, and I will help you with any kind of pooping problem that you have. So pooping is important. I say to my kids that are, grammar school age, that hold it all day, someone who has not pooped well is grouchy. So are you grouchy? And a lot of times they'll say, yes, my stomach hurts all the time. And I'm like, it's because you're not pooping. So we'll talk about diet, we'll address pooping, and then we will address sleep. And that is any sleep from my baby won't stop crying at night, or they have their nights and days switched around, to my toddler that now is in a toddler bed and comes and gets in my bed every night, to someone who doesn't want to spend the night out or is afraid to sleep over or go to camp. Wetting the bed is a big one for sleep. And then the last topic, the last point that I'll hit at the checkup is development. So of course that can vary from a social smile at 6 to 8 weeks to why is my baby at 4 months not meeting the milestone of rolling over? And honestly, since babies have been slept on their back, they've rolled over later. And big, healthy, fat babies don't roll as easy. So we'll talk about tummy time when that happens. We'll talk about walking, and when it's too long that they haven't walked. I always tell people when they say she hasn't walked and she's 16 months old, and I always say, does she cruise? And if they say yes, and I'll say, if you hold her hands, will she walk? And they say yes. But as soon as I let go of her hands, she drops to the floor and crawls. I think that's more of a personality temperament than it is an inability to walk, if you know what I mean. So those things are really fun to talk about. I love developmental questions. And then obviously into school age, we worry about performance, and we have a performance driven culture. And sometimes we have to step back. Sometimes we have to get testing. Sometimes our testing is to see what assistance the child needs, and sometimes it's to stop putting demands on the child that they don't need because they're not capable of reaching those bars that you've set for them. So developmental issues are really, really important. I talk about immunizations every day of my life, and I have done a lot of medical mission trips and human trafficking mission trips, and so I'm super passionate about immunizations. I'm a big advocate of them. I'm so sad that the world is skeptical, but I'll tell you, I did not come from an educated family. I did not come from a medical family. And if I had not gone to medical school, I would be sitting in the skeptical camp. So I am very sympathetic to that and empathetic to that. I know that we're in an information age where you can get information to support anything you possibly could think of. And what I do know is when I go to a third world country, they ask every single time if we brought immunizations. They know what it looks like for a child to have polio. They know what it looks like for a child to die of diphtheria. They know what measles can do to a whole village. And they would walk 10 miles with no shoes on a hot day and not ask any questions and let you use a rusty needle to get an immunization. And I am sad that we're in a world that causes you so much unrest and fear about something that I believe really does help our culture be so well that we can ask the questions. So please ask any questions at the end that you have. I've covered a lot of information. I have this great African proverb. I know that's so crazy that I said that, but it is so good. And I think it goes along with the relationship aspect of a pediatrician. So if you don't have a relationship, you need a relationship. Sometimes doctors can be like a pair of blue jeans. You and I can be the same size, and you say, hey, where did you get those blue jeans? And I say, I got them here, and you go get them and put them on, and they don't fit you. Well, doctors can be that way. So try them on, and if you hate them, move on. There are lots of choices. And I'm not saying leave your doctor, but I am saying you need to have a relationship with your doctor. And if you don't, seek that out because it's really important. It is so important. You'd much rather have a relationship than just an appointment. And so, like I remember that patient that had the pulmonary embolus. Her child is double digits now, and I still remember that like it was yesterday. So my African proverb is this: if you want to go fast, go alone. If you want to go far, go together. It takes a village to raise a child, and it is really important to have all of the pieces in place, whether it's a dietitian, a counselor, an OBGYN, a lactation consultant, or a pediatrician. You need a village. So we want to help you with that, and I hope that y'all will feel confident when you finish with this that that we're here to help. So thanks a lot.
Thank you so much, Dr. Phillippi. That was a lot of great information. And my babies are 8 and 6 now, and that is definitely a lot to think about, even for a mom with older kids, and how important it is, like you said, to have that relationship with your pediatrician. We're going to